Hello, I am Dr. Ntuba Thompson. I'm an international physician, a political leader, communicator, expert in global health communication. And I want to update you on our work on non-communicable diseases in global health. Now, when we talk about the burden of disease, previously it was basically infectious diseases in Africa and low and middle income countries. But today we have a double burden, and some people are talking about maybe a triple burden with the re-emergence of neglected tropical diseases in African countries and middle and low income countries. But overall, some of the problems which were health problems related to affluence, that were basically issues that were found in advanced countries, are now happening in Africa and low and middle income countries. Issues related to lack of exercise, nutrition, and related things. We look at obesity, which is mostly decided by the BMI, the body mass index, and above 30, for many, it's a problem. And the related problems that go with that. Obesity most times goes with or may lead to diabetes. And diabetes has its own complications. High blood pressure, cerebrovascular accidents, stroke, COPD, or chronic obstructive pulmonary diseases, emphysema, chronic bronchitis, and related problems, and other chronic injurious agents and related things, which are non-infectious. There is need for the world, because we know that high-level meetings at the level of the United Nations have been done to address chronic diseases or non-communicable diseases, because they on their own are becoming great killers around the world. A lot of people have diabetes and they are dying from complications of diabetes, kidney failures, heart failures, high blood pressure, stroke, retinopathy, diabetic retinopathy, and other related problems and issues. Now, there is what we call high-risk behaviors. These high-risk behaviors are related to some of these chronic problems. And we can just address them by altering our lifestyle events. For many, it's inadequate or lack of exercise and physical exercise. In the United States, we have documented and realized that a lot of people don't walk. They drive their cars from their garage, so they move from their bedroom or from wherever, living room, into their garages, and they get into the car. So they drive their car from there to the garage of their office. A good example is the medical center. So then you get out of the car into a lift that takes you up to your office, right? And some people's offices are that close to the car. So, and the most part of the day, you didn't really exercise, you didn't walk, you know. Maybe you went into the clinic and you were in your office, you clerked some patients and, you know, did therapeutic regimens for them and advised them and gave them scripts, you know, and they went and got their medications and bye, they went. And you did that maybe for 20 or 30 or 40 or 50 patients as it may be according to your load for the day, and that was it. If you are one of those who do theater work, for those who are in the area of obstetrics, then maybe in between clocking patients and, you know, follow up or rounds in the rooms or ground rounds, you know, with students, if you are in part of faculty that is teaching residents or medical students, then maybe you walk a little bit here and there, but in the most part that may not be enough. What about if you don't have a house gym, or you don't even have a registration for any gym somewhere? Then it means that you are not really doing any physical activity that helps your health. And lack of physical activities and exercise and sports on its own is a risk factor for some of these chronic diseases or non-communicable diseases I've talked about. So just losing weight and making sure that your BMI or your body mass index gets below 30 is a good index for us. So it is not only the information or the education that we give in the area of global health, but it is making sure that you actually put in practice that which benefits you. Because information is all over the place. If you don't translate it into action for you to benefit, then the information is useless. What about if I inform you of the benefits of quitting smoking? Of course, you know the benefits of not smoking. But you don't quit. You may develop bronchogenic carcinoma or, you know, cancer of the lungs and related problems, you know, some of those things. How many people know that some of the chronic problems that they have, which are like cancer and related problems, are just related to certain substances that they take, they abuse. But for some people, it is abuse of cigarettes. And just stopping will help you, you know, with your lungs and breathing health issues. So there are those things that, or those life changes which are expected that we've been involved in. We've developed resources, we've been part of the specialty meetings, we have talked with the experts, we have brought the expert advice of the consultants, the professors around the world, especially in America. And we expect people to use them. So if you have diabetes, one of the easiest way to manage it is to lose weight by exercising. So you may just get certain exercise machines if you don't want to go to the gym, or walking around with people or running and all of that. But you need something that is going to, you know, physically exert you. And then we talk about nutrition. And they want you to eat less carbs or carbohydrates. So if we combine exercise and good nutrition habits, more vegetables and and nuts, fruits, then we'll see that we could be able to even manage our diabetes, and our A1C levels may go beyond 7. So those are some of the things we've been doing in the area of chronic diseases or non-communicable diseases. I talked about COPD. For many, it is related to cigarette smoking and just stopping, just quitting. And we come in there to teach you, to help you to come along, so that you'll be able to quit and stop cigarette smoking. Then you will benefit from that. The chronic obstructive lung diseases on their own are not too good. And then the risk of developing lung cancer. Just lifestyle changes. Doing away with risk behaviors. And as I said, in this area is smoking. For some people, it's alcohol. And liver cirrhosis. And hepatocellular carcinoma, or cancer of the liver, because of these pathologic changes that injurious agent, alcohol itself, has the ability to make. And not only in the liver, gastritis, your esophagus, the mouth, and going right down on your GI tract. So they talk about moderation if you can't quit. And related things. For exercise itself will help you with CVS problems, cerebrovascular accident, stroke. Now it could be thrombotic or hemorrhagic stroke. A thrombotic stroke is related to a blood clot. A hemorrhagic stroke, most times we'll talk about an aneurysm, burst in your brain, and there is a bleeding inside your skull or inside your brain. And then parts of your brain being compromised or affected, which will lead to other problems, which doctors may pick from lateralizing signs or related, paralysis here and there and other related things. So chronic problems, or chronic health diseases or non-communicable diseases on their own are a global health challenge and problem which we've been addressing through some of these lifestyle changes and health promotion methods. No doubt, there is the secondary and tertiary protection and promotion methods, which require us to clock you in the clinic, make a diagnosis, and then give you medication. Some people actually begin to learn the tertiary form of prevention when they are maybe in a teaching hospital and after some operation, and then they are told that you still have to do this lifestyle changes so that you get some benefits. So we talk about exercise and sports. We talk about quitting some of those carcinogenic substances that we take in cigarettes and alcohol and other injurious agents that we take in that create this problem. Most times it's just quitting, and then you get the benefits of quitting. These chronic problems are a global health issue because they are transboundary issues, they are international, they are found in all the continents and all the countries. And then for certain places, they suddenly become an epidemic. Today they talk about an obesity epidemic in the United States. With each passing day, many people are obese, children are obese. And that's why we're talking about people dying in minority communities because they have pre-existing conditions. And we're talking about obesity, diabetes, hypertension, and other things. I remember I started hinting the fact that COVID-19 outcomes may be worse in people who smoke. And I was discussing that with Dr. Pez and asking him if he had any idea about that. He was, well, there is no data and scientific evidence that puts those together. But today, there are scientific evidence and data that are saying that people who smoke may have worse outcomes when they are infected with SARS-CoV-2, because I had thought that, of course, what cigarette does to the lungs and the lungs parenchyma, in destroying that, if you bring a related, another injurious agent, this time a virus, to come in and do more damage, it may be worse for people who smoke. I didn't do any experiment. I was just looking at the pathology and relating it and putting one or two together. But as I said, it's been confirmed that correlation is there. So we've been involved in quality of life committee work at the city of Houston, City Hall, other cities. We've traveled extensively and worked extensively in many states in the United States and in many cities. We've spoken in many meetings. We've participated in many meetings. We are very, very satisfied with our work these past 10 years. And we are aware that non-communicable diseases or chronic diseases have been given a proper attention at the level of the United Nations, where a UN specialized meeting has looked at the problem. So that aspect of our global health work has properly been done. We'll continue to do more as we travel around the world, to Africa, to South America, to Asia, to Europe, in the American states and cities. We at this phase of our work, I'm doing a lot of consulting and international speaking and developing resources and developing teaching materials and videos and educational materials and informationals, which to me is very good because those resources will be there and they can go to places that I may not be able to go to. There are people who access our resources in the magazine online in China, in Asia, in Europe, in America, South America, other places. So the resources themselves are going to places that I may not be able to go. That's a form of outreach. So we will continue, and I want to especially thank my assistant, Mr. Michael Womek. He's been with me most of the times, most of the places, and I thank him for the contribution, because most times it's not easy if you're alone. But our team, our partners, and our contribution from other places have been of great help. And I especially want to appreciate the mayor of the city of Houston, Mayor Sylvester Turner. He's mobilized lots of resource persons and people and brought them to the city, and with them we've been able to, elicit answers to certain questions and then produce resources.